I encourage parents to not even wait until you get to the like, oh, our lives are falling apart. Like, let's not wait till we get to that point. But when you're kind of like, I don't know, is this an issue or not? That parent gut feeling that we start to have, like, I don't know, this doesn't seem right. Then take that step then. Because what can happen is, well, a mental health professional will be like, no, they're fine. This is normal development. Or no, this is not okay. Let's put some things into place to help them. So it's just really important to seek help early. It makes a huge difference when it comes to outcomes, a huge difference for the child, for the family. Definitely reach out early.
Hi, I'm Peavy.
Hi, I'm Jamie, and welcome to Blank is a Mother podcast.
We are two toddler boy moms that have been best friends since college, and we are here to share our unique motherhood journeys through a comparative lens.
And we all say we're not supposed to compare, right? But clearly we know that's not realistic.
Because the first few years of motherhood shook our lives and friendship like no other experience has.
And by comparing and contrasting our journeys, we've discovered the strongest threads of sisterhood yet.
We don't have all the answers, and we sure have made some missteps.
So we invite you to follow along as we do our best to nurture our friendship while making 1,000 tiny mama decisions in an unfair world.
Hi, I'm Peavy.
Hi, I'm Jamie, and welcome to Blank is a Mother podcast.
Today, we have our second guest, Dr. Hammond. She is a psychologist from Tampa, Florida, near Jamie, and she is so dynamic in her expertise and her professional world. She focuses on mental health from everyone we learned age 3 through corporate executives. So she just had so much to offer our conversation that I think went in a lot of different directions, but was really, really interesting.
Absolutely. You do not want to miss this episode. There are nuggets of knowledge, there are recommendations, there are tips on things that you can do if you are trying to find your way through the journey of further understanding our children.
Yeah. I mean, both of us in our respective families have had challenges with the developing world that our children live in and how they are treated and interact at school and across our families, across cultures, different labels. And so these things are real, and it's really hard to talk about. It's hard to talk about in your own home, in the safety of your own family unit, and it's even harder to talk about with other caretakers or close friends and family members. And I really liked our conversation around how to have these conversations, how to get support, how to lead with love. Yeah, she had a lot to offer in suggesting some of those things. So
buckle up, get ready for this episode. Dr. Hammond, thank you again for your time and your expertise and your presence. We look forward to our community providing us with feedback and thoughts, and let's get it.
If you could just introduce yourself and tell us and all of our listeners how you became focused on mental health in children and young people, and now in the corporate world.
First, thank you so much for having me. I'm so delighted to be here with you all today. But yeah, I'm Dr. Nekeshia Hammond, and I'm a psychologist, executive coach, and speaker and author, and doing multiple things, which I'm excited about. I absolutely love the field of mental health. I love talking about wellness. As you mentioned before, my background, I have a private practice that I've had for next month will be 15 years, which is insane because it feels like just yesterday. But our focus has been ADHD evaluations and learning disabilities and like gifted testing, those type of evaluations. And now I'm doing some of that and also having talks with corporations about how to have more work-life balance, because especially after COVID pandemic, it has been just the world turned upside down and we're still healing and recovering from that. So I'm definitely in that burnout prevention space now, along with still helping parents, still trying to navigate through. I know you mentioned earlier, just putting yourself first, which I love to hear. I preach that all the time. It's really, really life-changing when we start to do that. But yeah, I absolutely love this space. I've worked a lot also in public education, just with different media outlets and that sort of thing, because I'm really, really big on the prevention side of this. There's a lot that we can prevent with mental health if we have the education to do that. So I'm super excited to be here.
We are super excited to have you. So thank you for your time today and sharing your lens with us and your expertise with us. So thank you.
Absolutely.
Yeah, if you don't mind, I think I can kick it off with a question for you. And it's unique to my family's experience over the last few years. So we have a very spirited, very bright, very emotional and sensitive child. His name's Everett. And like I mentioned, he's 4.5 now. And when he was 2.5 is really when these behaviors were kind of coming into focus and like in our face as being maybe a little bit more extreme on the spectrum of like normal toddler behavior. So what's interesting about this is that exact moment where we were kind of really getting into it, my husband and I, with like parenting this, what I would call, a challenging toddler, is when my family visited Jamie's family. And there were some issues there that I think were rooted in like normal toddler behavior, because my son at that time was 2.5, her son was 1.5. And so we had a lot of things to navigate during that trip. And we had an episode on this, so our listeners kind of know what we're talking about here. But that, and then several other scenarios after that, between like 2.5 and 3.5, we were very challenged by trying to be the kinds of parents that we wanted to be with this toddler that was really testing the boundaries and also had kind of the normal executive functioning struggles of toddlers as they're developing, but really at the extreme, like, very physical. We were in like this phase of denial and just kind of saying in his defense, he's just a toddler and he's just 2.5, or he's just 3, he's just 3.5. And then at about 3.5 to 4.5, so this last year of ours, we kind of got to this place of more acceptance and realization, like he might just need more support than your average toddler. And we clearly need more support as parents, and we need more information. And so that's why we've started to seek this ADHD assessment. That was a long-winded way to set up this question. And I'm wondering if you can just share with us all, what are these executive functioning skills that toddlers, as they develop, should have, lack, struggle with, but are developing? And then what are the kind of signals that parents and caretakers can keep an eye out for that might indicate this kid might be struggling a little bit with X, Y, and Z and might need more support? When should we bump our head against that wall and say we need to get more information and seek help from professionals?
Well, first, before I answer the question, I wanted to really commend you for taking that step, because it's so much easier when you start the process earlier. But unfortunately, because of the stigma of mental health, a lot of times that doesn't happen, actually. So in my experience, in my clinical experience, unfortunately, sometimes I'm seeing kids in high school that needed the assessment when they were 4. But it's hard. So I just wanted to commend you first for taking that first step. But to answer your question, as far as like executive functioning, it comes in different categories for younger kids. So one of the categories is like impulse control, which is easier said than done, because when we think of 2-year-olds and 3-year-olds, we think of tantrums, because that is sometimes how they express themselves. But executive functioning comes in the form of impulse control, something called working memory, which means that you take in the information, you kind of store it, and then there's some type of output, which is really, really hard sometimes with kids who have ADHD. Their working memory for some kids is very affected. And then the third area is looking at their, what we call like cognitive flexibility. So it means if you say, hey, we're switching to a new activity, or we're going someplace, or you have to stop playing with what you're playing with and do something else, that sort of the thoughts, the cognitive shift to do something else, that flexibility, are the different ways that executive functioning expresses themselves in younger kids. When do you know there's an issue? There's a couple ways to determine that. One, it is completely normal for little kids to have tantrums. Like, that's normal. However, at what frequency is that happening? What's not normal is for this to be happening multiple times a day. It's very intense. It's taking hours and hours to get through, to self-soothe, to get through the tantrum. It's affecting others. Maybe if they're in preschool, if they're 3, 4, it's affecting their behavior with others, with peers. They might not be able to relate to their teachers. The more areas that it's starting to impact, when teachers start saying there's a concern, when you start seeing the concern at home, when the child themselves, you can literally physically see them struggling with this, that's when you're like, hey, you know what, let's reach out to a mental health professional and see. And one of the things with executive function, I will say, is that it means a lot of different things. So yes, for ADHD, executive functioning issues can be related to ADHD or something else. It can be related to anxiety. It could be related to depression. It could be related to this children having a learning issue and they're frustrated with that. Like there's so many ways that our brains are set up. I've given thousands and thousands of IQ tests and there's just so many different variations, which is why it's really, really important to seek out a mental health professional. And the last thing I'll say about this is those are just, I don't want to say the extreme ways, but the ways that like for sure you need to seek out a mental health professional. I encourage parents to not even wait until you get to the like, oh, our lives are falling apart. Like, let's not wait till we get to that point. But when you're kind of like, I don't know, is this an issue or not? That parent, gut feeling that we start to have, like, I don't know, this doesn't seem right. Then take that step then. Because what can happen is, well, a mental health professional will be like, no, they're fine. This is normal development. Or no, this is not okay. Let's put some things into place to help them. So it's just really important to seek help early. It makes a huge difference when it comes to outcomes, a huge difference for the child, for the family. Definitely reach out early.
I'm smiling because Dr. Hammond, so my son is 3.5. His name is LJ for Little John. We've had a different experience in that LJ is at a private Catholic Montessori school that you can start as young as 11 months old and you can stay there all the way through the end of 8th grade. So if you find your happy place, if you will, or you find that it's actually beneficial to your child and they can grow up with the same children that they've been, around, there's a benefit to that. With LJ, he is the only Black child in his entire program. I have on this sassy Christmas sweater right now because he had his Christmas show at school this morning. So, we had to dress for the occasion. But nonetheless, there were 3 children's homes that came together for the show. And of the 50 children there, again, just not in his class, but in the entire house of 3 to 5-year-olds, it's LJ. And so when we started this year, he was there last year. At home, he is this gregarious, funny, witty, intelligent little boy and very social. He wants to chit chat. At school, last year when he was 2, it took him a while to open up, which is normal. We're like, well, he doesn't know anybody here. And quite honestly, I don't know at what age you become aware that you look different or you are different from your classmates. I don't know when that shift happens.
Yeah, preschool for sure.
That's good to know. Thank you. Because we're like, is he aware? We know that he's aware now. We can feel that.
Yeah.
So this isn't a program that he's not used to, but they're different teachers, a different setting, a different classroom setting. So fast forward to this year, he's having potty accidents daily, sometimes twice a day. And we thought, okay, well, he's just getting used to things, right? Normal, like you said, Peeve, right? This is normal. It's a new environment. So that has become an issue. It's no longer an issue, but that was an issue at the beginning of the school year. Then it was followed by, he struggles to make eye contact. Now, my little squiggle lines are coming up because I'm like, are we using trigger words here to try to label my Black child before they've even had enough time to spend with him? And of course, in mommy mode, I'm like, I know my child. I know what he's capable of. I know that he doesn't struggle with eye contact. So what is it about this environment that is potentially making him uncomfortable? What's triggering that? So we have the accidents. We had these trigger words in this report. Oh, he struggles to make eye contact. And then it was, oh, he sometimes spits out his apples. So there may be some sensory. And, oh, his fine motor skills. When we ask him to do certain things, his fingers get limp and we think there may be a problem with his fine motor skills. So all of these things are news to us. And we're like, But again, I'm thinking, oh, there are trigger words in here. they're already, and this could be mama mode, but they're already trying to label my son without having really spent much dedicated time with him. And we know that not to be true in other settings. So that's our background with LJ at his school. We did send him to his pediatrician to do an assessment. The pediatrician's like, there's nothing wrong with this child other than he doesn't want to listen all the time. I'm like, well, I don't either. And that's normal for 3-year-olds. But my question, Dr. Hammond, is can you speak a little bit to what are both sides of the coin of labeling a kid, whether you're asking your child to be labeled or to be diagnosed, as opposed to teachers or administrators trying to label your child preemptively?
Just like put them in a category.
Yeah. What's the impact to the child? And at what age can the child feel like they are being labeled or potentially being treated differently?
I have seen preschoolers go through that, like where they feel different because of sometimes what teachers are saying to them, which may or may not be true, right? That's not necessarily a clinical assessment here. It's someone's opinion, which again may or may not be true of the situation. But again, I commend you as well for going to the pediatrician, for getting the evaluations, because I really have seen it both ways over almost 15 years. For some teachers, they're absolutely spot on. When I test a child, they may truly have ADHD, and the teacher recognized that, which was great. And it's valid. And I've seen the other side too, where I'm like, no, this child doesn't have this, or this. It's really this. It's something else. Maybe it was trauma, or they're going through something, or COVID-19 pandemic. They're stressed out, or something else was happening that looked like different type of behaviors. But the pros and cons, if you will, with labels, I see it more as a pro. Maybe I'm a bit biased, obviously, in the field, because I've seen so many kids get the accommodations that they need, which was life changing for them. I mean, there are kids that were great kids, like just great kids, but they were struggling with impulsivity. They were struggling with slow processing speed. They couldn't do their work on time, and they were getting into trouble for these things. And all the school had to do, which they did and put into place, was something like extra time or sitting in a different location so they can help them pay attention, or just different things that they put into place. And all of a sudden this kid went from a C student to an A student because that's what you put into place because they needed that. But I don't want to get my soapbox too much, but we had to give this report to say like, hey, please help them.
Yeah.
And that's where we're at, unfortunately. But that's the pro of the label, if you will. The con of it, though, to your point, which I see also, is unfortunately, there's still stereotypes about mental health. I have had numerous conversations with different organizations about what it means when a child or adult has ADHD, what it means for depression, what it means for anxiety, because we want to make this like one size fits all. Like when we hear the term ADHD, all of us, we have certain thoughts, or depression or anxiety, but most of the information out there is not even true. There's amazing kids out there with depression, anxiety, and learning issues and ADHD and all sorts of different things. Like they're not the stereotype of what it is. Like they're really successful, amazing human beings that just happen to also have some type of medical condition, mental health condition. Yes, the stereotypes still are there, which I urge parents when I have conversations with them to be advocates for their kids. And I'm like, here's the report, for example, like, yes, they may have fill in the blank, whatever label, but also here's all the strengths they have. Like their IQ is great. They're good socially. They're amazing human beings. Like they're in extracurricular, right? Like here's all these amazing things about them. But yes, they might have a learning disability or ADHD or something else. So I encourage parents to advocate for your kids because yes, unfortunately, you might encounter a teacher or whomever else around you, even a family member, sometimes that have negative things to say about what they think this label means, which again is not always true.
Thank you for that. And I will say, Dr. Hammond, that after his initial parent-teacher conference, my husband and I did make an appointment prior to me even going in for my double mastectomy. I said, I can't focus on this if I don't think my baby's doing okay. Or doing okay in that setting. He's doing fine in every other setting. We did have a meeting with the principal, the head of school, and his 2 teachers, which we called. And it was a very productive meeting in that we were able to say, this is what his pediatrician said. This is what we observe at home. This is what we know that he is capable of. So can we figure out what's going on in this environment where he is not able to be his authentic self? And since then, there's been a lot of progress made.
That's wonderful. I love it.
And I also commend you, Jamie and John, for being so patient and being LJ's advocate, because that intuition that you had, that I have on the other side of the coin, that intuition you had, like, there's really nothing wrong with him developmentally. He doesn't have these challenges that they're trying to portray. And from an outsider perspective that knows your son, my son, and all kinds of other kids, even I knew, I think it's more that he's not connecting with these adults. And so that's why he's not responsive. He doesn't trust them, or there's something not great about that relationship and their dynamic. And that's what needs to be improved, not necessarily these skills that he does have. He's just not excited to do those skills and practice those skills with those particular people. Right. So it's great that it has improved.
Thanks, Steve.
Kudos to you guys for going through that process. It kind of spurs this other question I have. It's hard when you have this intersectionality of cultures and backgrounds and identities, especially around parenting approaches and discipline styles. And so I'm sure you're well aware there's kind of this new wave of like gentle parenting, or however you want to describe it, of kind of changing the way that we've traditionally parented young people. And so my husband and I and our families are trying to adopt that as much as we can, like that makes sense to us, that feels good to us and authentic to us. But my son has pushed every boundary in that, like he can really push the edge. I will say, like 4.5, I feel like we've turned a corner and he's made massive improvements over this past year. And I do pat ourselves on the back, because I think sticking to our desire to be patient and calm and like be that grounding force for him. We're not always successful, but we try our hardest. And I do think it has made a difference, but it's really, really hard. And it's especially hard when we're in these other environments. So like LJ going from home to school, as Jamie described, massively different environments for him. And my son visiting our friends in their homes and their environments, and even visiting our family. Fortunately, we have a different scenario at school where he goes to the YMCA preschool, and every walk of life has come in there, and I love it. And it's just such a great community for him. And they're like the opposite end. They're like, what can we do to better support him? What's working this week at home? It's just so
great. It's so great.
Yeah.
I'm hating a little bit. I'm a little jealous. That's awesome.
No, they are fabulous, and I can't say enough great things about them. And I feel really fortunate that we found that situation, because I could see how it could be really different if he had a different preschool environment. That would be even really challenging. Anyway, the question is, what are some tips to communicate needs, especially related to parenting and discipline, with these little people who, might be like LJ, who just need more connection, or might be like Everett, who struggle with some of these impulse control and executive functioning skills. But I've had a really hard time, especially in the moment, talking through this like elephant in the room almost with these various people who, a lot of them are my loved ones. And it's a hard thing to talk about. Hopefully that makes sense, kind of what I'm asking for suggestions for.
Yeah, and it is critically important to, like you mentioned, having these conversations with others, like family members, and trying to set up, which I'm not saying this is easy to do, but trying to set up the boundaries for family members, what works best for you and this child. And even for, anyone listening that has multiple children, sometimes one child is really different from another child. They just have different needs, but it's still really important to have those conversations, whatever it is that their needs are. So if their needs are sensory and they cannot be in a loud environment and you're out of family functioning, and people get upset sometimes. I've heard plenty of these stories where family members have to leave early. And it's like, why would you leave early? Like, how dare you? And it's like, well, you have to put the needs of this child important. If it's too loud or, whatever it is the case, like, yes, we have to set our boundary. We might not be able to stay the whole day. We can stay for an hour or two, or, whatever it is the situation. But we have to remove ourselves, to help our child, or whatever it is, as I mentioned, that if the child needs more breaks, even if they're at family gatherings or someone comes over or whatever it is, like that can be helpful to them. And those things have to be explained to other family members, but also know that sometimes, again, there's a stigma of mental health. So it is difficult sometimes for people to get it and understand it. But I think it's still important as a parent with our own set of values to express that to others and try to advocate for this child, even though aunt such and such may get it, but uncle such and such may not, like just understanding not everyone is going to understand that. I had actually, well, anyways, an individual that I knew of who was hiding the diagnosis of ADHD from her family because culturally, like they were just like, nope, we don't believe in that. We don't want to hear about that. That's not true. He's just being a boy, all those sorts of things. So she had to hide it from her parents, and she did what she needed to do and got him the treatment that he needed for the ADHD, but she couldn't, she just completely didn't tell her parents about the diagnosis because they were so unaccepting. So I say, do what you need to do. If you can express it to some family members, if some are just so anti-mental health, do what is best for this child right now. Because at the end of the day, with therapy, for example, it's completely confidential anyways. The therapist or mental health professional is not going to be sharing with your family members what a diagnosis is or isn't. So the best thing is just think about what can I do that's best to support this child right now.
Yeah. I think we're in a gray space because we don't really have that diagnosis yet. And so a lot of our situations that feel icky are people trying to suggest, well, if you just did this, or when I had my kids, I just set clear boundaries and I had consequences and they, were in line, or my kids never did that. Have you tried this? And do timeouts or whatever it is. It's there's a million offerings unsolicited.
Yes.
What I really want to tell people is say, can you just lead with love first? Can you just lead with support first and just say, this looks hard. What do you need? Do you want to talk about it? We know this kid is amazing. Let's find a way where I can connect better with them or support you better. This is a common theme that Jamie and I have throughout all of our conversations. I think because we are, and you're probably the same, just really go-getters, we're type A, we're can-do kind of women. It's hard for us to ask for help. It's hard for us to say, we're struggling. We need help. We need your empathy. We need whatever it is that we can identify. And honestly, I went through a year plus without even knowing how to identify what I needed. I just knew I needed people to care, especially people who are really close to us. And so I really struggled. And that kind of led to resentment and anger. And those are my things to work on. And I am. But I feel oh man, maybe I could have avoided that had I been more communicative or just tried to somehow explain to people in the moment or after, we just need your love and understanding and support. We don't need your criticism or your cold shoulder or,
Or your unsolicited advice when you aren't an expert, sir or ma'am, but I digress. I mean, it's everybody has an opinion. You're right.
Always.
I always label Dr. Hammond, PV, and I have talked about this a lot, that I'm very heavy on this concept of toxic positivity, which PV, I think you introduced me to the concept through another podcast where people mean well. Bless their hearts. They mean well. And they want to tell you, they feel like they have to find something to say. And so in their attempt to be positive or to be encouraging, sometimes it has the opposite effect where it feels condescending or it's minimizing your feelings or your experiences in that moment. So I've been working through that, unrelated to LJ, but just through my diagnosis, where people, they mean well, but in their encouragement, they say things like, it's not the end of the world and you'll be okay. It could be worse. I'm like, it could. I appreciate you pointing that out. Thank you so much. But in this moment, ma'am or sir, I am going through my own emotions, and I need for you to say, it's okay to feel all of these emotions. Both can be true. You can still know that this will pass while you're also feeling frustrated and sad. And so I guess it's similar to what you're saying, PV. I can still know that I have an awesome, loving, funny, cool kid, and know that I don't need you to say anything to me other than, how can I support you? And you do have a cool, funny, awesome kid. How can we support you in these efforts? So I think people also need to know that.
I completely agree that if that question could be asked more, like, how can I support you? Because it is hard, especially for women. Like, it's hard to ask for help, especially when you're the strong one sometimes, or you're the go-to person for everyone else. It's hard to ask for help. And it's hard to know, like you were saying before, like what you need, which is why it's something I preach often. It's really important for us to get as much as we can. I know we have kids, but to get into calm, quiet spaces, to get the clarity, to know what we need, because our needs change. Like what we needed this year could have been different from last year and is going to be different next year. But when you get into really calm, quiet spaces and start to really reflect and ask yourself, which we don't do enough, what do I need? What do I need? How am I doing? Checking in with yourself, then you know those answers, and then you can communicate to others if they're not saying, hey, how can I support you? Which most people aren't. But then you can say to others, like you said, like you might want advice. Some people want advice. They're like, please, I need advice. And some people are like, please, I don't need any more advice. I just need you to listen to me. Or I don't need you to even listen. Like, I'm not ready to talk. I need you, to be helpful in some other way. Like, I need you to watch my child, whatever it is. Like, there's a lot of different ways of support, but all of us need different things at different times. So that communication is really, really critical.
I had mentioned this to John. We were having conversations just in general. And Dr. Hammond, he's an attorney. So he's very slow in his delivery. He's very thoughtful.
Yeah.
Meanwhile, I'm like spitfired. Whatever I'm thinking is going to come out. And I apologize in advance for my delivery. But one thing, we've had this conversation because I've said, just say, how can I support? How can I support you? And his response, which I think is interesting, which I wonder if this is what more people think than not, his response was, but asking that question doesn't feel supportive to me. Because it feels like I'm putting the burden back on you for you to tell me how to support you, as opposed to me listening and then sharing with you my feelings or my suggestions. And even in my smart mouth, I thought, oh, that's a really interesting spin on that. Because what would feel good to me, and in this conversation would be, how can I support you? But his response made me say, okay, well, maybe that's why people don't ask. How can I support you? Because they may feel like they're putting the burden back on the askee, if you will, if that's who that person is.
Yeah, I'm glad that you just shared that, because it is kind of exactly what I was going to ask. Is I've been trying to flip the script for myself. Like, okay, put myself in their shoes, because like John and all these other people, they do mean well. Like, they have wonderful hearts and they do love our family. So I know that they're offering the unsolicited advice or making the comments or whatever, whether they come out snarky or not, like deep down, they are coming from a good place and they do want to help. They do want to connect and show love. They just don't know how. And so I've been trying to think about, like, if the shoe were on the other foot, if I were in their position, what could I do? If you see someone struggling, whether it's a loved one or someone at your workplace, what can you do to lend your ear or do something that isn't going to be putting the burden back on them, or, some of these other things that we've talked about? Do you have tips for those people that are in those situations? Like, some of our family members have been in that situation, I know, because they don't want to approach us. They don't want to seem critical. And so they ignore it, which actually can be more hurtful.
Yeah. Yeah. And I still think it's important, even if, and I hear what you were saying earlier about your husband kind of saying, like, if I say, how can I support you? Then I feel like I'm not supportive enough. So in that case, then it's still important, though, to ask however you feel you want to support someone else, to ask if that support that you're trying to give is okay. So maybe you don't say, how can I support you? But if, let's say you want to give someone a hug, not everybody wants a hug, right? Like, sometimes my son, I adore him. He's 11 now. So sometimes I want to be like, do you want a hug? And he's like, nope. Or maybe he's like, yep. But I have to know, like, what space are you in? Or even if you're like, do you want some advice? Sometimes people are going to say no. Or do you want me to just listen to you? Like, whatever you think supports this person, ask them first, because they're going to let you know. And it does, sure. It could take the burden off of them just for them to come up with a solution. Maybe you have one, but that's not the solution that they need at that time. But I still think it's really, really critically important to ask the person. I know I've had in talks with, in the workplace, for example, and how do I support this colleague that's going through something, or they're depressed or anxious or whatever it is they're going through? anyways, there was an employee that wanted to give therapy options to this other coworker. And it's like, well, let's ask them if they want that. It's a great, meaningful thing to do, but they may or may not be in that space. But saying, hey, I know of someone, do you want their information versus like, here's who you need to go through. You know what I mean? Like, it's just a different vibe when we do that. But again, even for family members, it's the same thing. Like, just to pour in and try to do interventions, I cringe sometimes at some of the things that are just very well-meaning, but for the person that it lands to, it can come off harsh, it can come off not supportive, and it actually opens up a whole other piece of things now that they need to work on because of that interaction, when we could have prevented all that by just asking, right, if, XYZ, like, would this be helpful to you? I really hope we start to more get into the space of that. Let's ask, like, is this supportive to you?
Yeah. Can I prompt a topic that I actually think Jamie can speak better to than I? But, everything we've talked about so far, I can see like thinking through and implementing in our own little worlds and our like comfort zones. But there's so much mental health stigma and challenges to acceptance and approaches in different cultures. And so specifically in the Black and Brown communities, and like this has come up in other discussions and like at a different angle, but for parenting and raising young people, like Jay, do you want to bring up anything specific to those kinds of considerations for culture? Because you have not only like your Maryland, DC, Black and Brown communities, but also your Jamaican family. Like there's a lot going on there.
I have to say, Dr. Hammond, I am Jamaican via marriage, and in my spirit and in my heart, I should say.
Love it. I love it.
And actually, my husband, I told him that you were to have Jamaican descent as well. And he's like,
Yes.
all right, because my husband's family is all from Jamaica. So he still has a lot of aunts and uncles and cousins there. And we did take LJ there so that he could meet his Jamaican side of the family. And so to Peevy's point, there are a couple different things at play. One thing I spent a lot of time talking about and thinking about is how do we create a culture within our smaller families? Because with our culture, it's really this agreed upon set of expectations within our social communities of what respectful behavior is, what disrespectful behavior is, what a well-behaved child looks like or acts like. And so we talk about coming into a family unit. I'm bringing my cultural norms of the way that I was raised and my communication styles and the way that I approach conflict and resolve conflict. That's all rooted in how I grew up. And my parents, I think I would say were, how do I say this? They're probably first generation gentle parents, I would say. They were very much into, let's have a conversation. So to some of my family members, they were like, what is this? Why don't y'all just beat her and get it over with? Like, just spank her. She has a smart mouth. My parents were of the mindset that they both had a lot of spankings growing up because they grew up old school where it's like children should be seen and not heard. So if you say too much, you're going to get a pop, and we keep it moving. They experienced so much of that when it came to my brother and me, they said, we're not doing that because we know how it made us feel. And so with you two, I'm the baby, that we are going to have conversations. So if we didn't like our curfew, they would say, well, call a family meeting, Jay. And I would say, I certainly will. And we'd call a family meeting. You wait on it. I love that. The family meeting is coming because I don't want to go to bed at 8:30. Thank you. There's shows to watch. So
I love it. Very important.
Yeah. I mean, I know you want me to do well in math, but I also want to watch this WWF match that's coming on at 9. So we would call family meetings and we would have the space and the platform and the ability to express ourselves. My mom to this day, I'm a whole grown woman. To this day, my mom says, Jay, we knew the answer was going to be no to certain things, but we wanted you to be able to express yourselves so that you felt like, you could do that and that it was okay to express the things that you wanted to be seen or to do differently. My husband's family, who I said is rooted, and his family is of Jamaican descent. My husband is also 8 years older than me. So we just have differences in styles. So we together collectively are trying to still determine what the
Mm-hmm.
cultural norms of our small family unit are. Which pieces of
Mm-hmm.
our respective childhoods do we want to incorporate into our parenting
Yeah.
styles with LJ? Which styles were like, no, we're not doing that with him. Can you provide any other guidance or any other anecdotes or anything around what you've seen about two different cultures? And again, I always say culture is not just race and identity. Culture is rooted in our expectations that we've been conditioned to believe is normal behavior. Can you share any anecdotes or any guidance on how to set the cultural structure, the new cultural norms of your family?
What I've seen that's been really, really difficult with cultural norms sometimes is we feel like things always have to stay the way they were.
Mm-hmm.
When they don't, like, you're allowed to change as a parent. We are now about to move into a whole new year, but sometimes we feel like we have to do things that were from like the 1930s. Like, life is different. So for those parents, sometimes I struggle, but my grandma did it that way, but my great grandma did it that way, but my parents did it that way. Yeah, but they lived in a different time. And I'm not saying however they chose to raise their families was right or wrong. It's just that they lived in a really different time. So my son right now, I mean, we didn't have social media growing up. We weren't on tablets at 2, 3 years old, right? We didn't have that back then. Like, he is in a very digital age. Like, just conversations are very different right now than when we grew up. So we have to keep that in mind. And culturally too, decide. So my mom is Jamaican and my dad is Ethiopian, and they're very, very opposite individuals and just very opposite cultures.
Yeah. Wow.
But nonetheless, yeah. And my husband's parents are from Jamaica. So we know how we were raised, but we had to make our own decisions. And to your point, some of it was like, what? You're not going to spank your child? What? Like, and it's like, well, just because we were spanked, like, we decided as a family unit that, this generation, like, we didn't want to do that. We wanted to find other ways. Yes, we still highly value respect. You better be listening to your teachers. You better, like, there's certain things we have in place for our family values, but all of the things that we experience in childhood, we don't have to bring 100%. Yeah. We're not at 0%, but we're not at 100%. So I would encourage people to really reflect. And again, it's not a right or wrong. It's just that it's really important to know that you are allowed to change in the times of change. I think a lot of times what I see on social media is it's like, oh, these kids today, they're just so horrific. And it's like, but our grandparents said that and our great grandparents said that, like every generation, because we want, we see like they need to be parented this way and they need to be parented, and it should be like the good old days. But I'm like, yeah, but we're not. We're in different times. So we cannot always parent exactly the same as in the past. But yeah, have those conversations in your family unit. Like, what do we believe in together? Or even if it's not together, but what do we believe in and how do we best want to support this child?
I love that. Thank you.
I love the Beal family meetings. I'm going to institute that in my family. We didn't have that.
But yeah, we have family meetings too. And not when I was growing up, but now. Which my son runs them.
Love it.
I love it.
It is hilarious. Yeah, I told him I'm going to get him a little gavel because like he runs the meeting since he was like 5.
Yes.
Note to self, get a gavel, because we do plan on allowing LJ to exercise his voice. And I will say, even though John said he didn't grow up with family meetings, his parents were like, what we say goes.
Yeah.
He is so like, you know what? I like that y'all had family meetings. Regardless of what the outcome was, you were allowed to express yourselves and put it out there. So gavel noted for LJ's upcoming family meetings. Thank you.
Yeah. Yes.
There's just so much resistance to the mental health. I mean, we've talked about this with different topics, like even talking about your body and things about your identity in that way, like your body image or things that might be not going well with your body and mental health. Like, just in those different cultures, there's a lot of stigma and barriers to addressing them and having those conversations. So it's really just like breaking that barrier to start the conversations. And I love like Jamie's approach, which is what she does in her work. And like I said, you guys have a lot in common with what you do professionally, but that she helps like organizations and family units now, because my family's adopting her skills, to define like your culture, that you can kind of be rooted in as you move through these different environments and these different conversations. But
yeah,
it's challenging. Hard.
going back to my particular situation with having a child that's waiting to be assessed. So for anyone else that's out there that has like a young child that they don't necessarily have a diagnosis yet, but they have these challenges, we've been kind of going through this laundry list of trying to get him more resources and, just support and experiences in other ways, trying to find what works for him. And so we've tried cranial sacrum therapy for toddlers, which I don't know if y'all know what that is, but it's basically like a head massage with a skilled professional, but it's like a head massage for a toddler. And it was hilarious because it's supposed to calm the child, right? It's supposed to just like an adult. It's supposed to be this calming, like this way for this professional to kind of tap into your energy and find that calm place for you. And so we tried 3 very expensive sessions with this wonderful woman in town. And by the end of the 3rd session, she was like, this ain't going to work forever. This is just not it for him. So she was sweet though. She was like, this is, I want this to be productive and useful and this is not working. So lovely to meet you. Your kid is amazing. He's going to be awesome. You'll find something else that will be supportive for him. But so that didn't work, but we tried that. And there's other therapies that have been recommended to us, like occupational therapy and speech therapy, which I would love more information about because, like I said, my son is really advanced in all of those things. Like his speech has always been very advanced. His physicality has always been really advanced. So I'm like, what would be the advantages of me seeking that out for him? So that's one question. And then we've also just tried karate and swimming have been great for discipline and kind of that sensory, full body thing. All the team sports, no, he has no focus for that. But we've also been reading a few books that are really helpful. So maybe you have some recommendations there too, your own books or some other resources out there for this kind of stage. There are coaches for parents with kids with ADHD. And I just feel like we're not quite there yet to invest in that, but I could see that being something that is helpful to us, especially during the schooling years. So that was a lot to throw out there of what we've tried. But if you could speak to any of those things or anything that I missed in terms of what we can kind of seek out, I would really appreciate it.
Yeah, no, for sure. So as you mentioned, I know you said you're on the waiting list, which is not uncommon, unfortunately, with evaluations. So, the mental health evaluations, but there's other type of evaluations, like you said. So with speech and occupational therapy, for example, sometimes when I do evaluations, I have to refer certain kids to a speech and language pathologist or occupational therapist. But what they do in their initial session is they also do their own evaluation. So they will say yes, your child does need occupational therapy or not, or they're fine. But what I like about, and the same thing with speech, what I like about it is they will do the testing to see where are they at with their age range? Are they on level or under, or maybe they're above? But they'll give you a more objective answer. It's really hard because even certain kids, I'm not a speech language pathologist. That's not my training. But to me, I'm their speech sounds a little off. So maybe go there to see to what level. Is it just slightly off, but this is normal for a 4-year-old? Or is this no, you need speech therapy, right? I don't know that because that's not my training, but I can send you to the specialist to find that out. And the same thing with occupational therapy. I've had many kids that I've tested. They have fine motor issues or some other type of difficulties, which again, that's out of area for me, but I'll say, hey, let's follow up with this professional to see, are you on level with that or not? I am a huge advocate, even though I will say, and I get it, it is sometimes costly depending on resources in a community. It is very time consuming too, but I'm really a huge advocate as much as feasible to get as comprehensive of the answers as possible. Because in my world, all the time, I see that kids are treated for one thing and they have 3 things going on. So it's why are there still problems in the classroom? It's because we're only dealing with one thing, but there's 2 other things that haven't even been addressed. So as much as possible, looking at the holistic picture for kids is so critically important. We don't do that often enough. And when we think of blood work, I think of it as blood work. So when we think of blood work for adults, we would never just test for one thing ever.
Right.
We don't do blood work for one. We look at however many different things is on that list. It's comprehensive. And it's okay. Like we go, yep, you're okay in this department. You're okay here, da, da, da. But you're, whatever's low, you're right. Like that's how we do it. And
Right.
it should be the same mindset for kids. So we're saying, okay, maybe you don't have ADHD or learning disability, depression, anxiety, da, 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 but you have some issues with speech or occupational therapy or whatever it is that you need. So let's look at the whole picture so we can adequately know, like, where do we put our time, energy, and focus? Because some of the other things you're naming are amazing, right? Like it's a great thing. We want to try things that reduce stress. Very huge advocate on that too, for adults too, for us too, right?
Amen.
But also for kids. And I'm glad that lady said, you know what, but after these couple sessions, like this isn't it for him. I mean, there's plenty of other things to try, but it's just certain things are just much more effective for kids, just depending on how they're wired. But you tried that though. Yeah. And it was something that could be very beneficial. So yeah, doing the things that reduce the stress, important. Doing the things that increase their level of support, very important. Like whether it's like a support group for parents and or kids, very important. And then again, making sure this assessment is as comprehensive as possible.
Can I piggyback off of that, Dr. Hammond? Because you've mentioned the ADHD testing. And then earlier, I think you mentioned, I heard gifted testing.
Yes.
And so are you able to share at all? And if this is secret squirrel, then that's okay. You can say, that's Jamie. No, I'm not sharing all my business today. But if it isn't secret squirrel, are you able to just give maybe like a high level understanding of what goes into the ADHD testing and what may go into gifted testing?
Yeah. So there are two very different types of testing. So like gifted testing, for example, is one test. It's a one IQ test. And then I think it varies a little bit, but anyways, in our county, you have to get a score of 130 or higher to be considered gifted by the county. Well, for the majority of schools, some schools have some exceptions, but that's like 2% of the population. So it's really hard to get that high of a score. But nonetheless, and you get into gifted programs and that sort of thing. So that's gifted testing, the one test thing. With a comprehensive psychological evaluation is what I tend to focus on. I don't believe in only looking at just is it ADHD, yes or no, because then it's like there's 12 other things. So I do what's called a comprehensive psychological evaluation. So that's looking at, there is an IQ test in the comprehensive evaluation as well, but it's looking at IQ. It's looking at, there's specific ADHD type of tests to look at executive functioning, to look at working memory. There's tests that look at socially and emotionally, how is this child doing? Is there depression, anxiety, trauma? There's learning tests. So it's a pretty comprehensive, it takes hours and hours to complete it, but it's a pretty comprehensive battery because again, I cringe sometimes when I hear of let's just give one test for ADHD. Yep, you have it, or no, you don't. I promise you, you don't know all that's going on. And actually the CDC, they did a study and 65%, almost 2/3 of kids that have ADHD also have something else too. So something else meaning like a behavior issue, or maybe it's a learning disability or OCD or some other condition too. So there's proof, if you will, in the stats, usually there's just a combination of multiple things happening, which is why it's so important to look at the bigger picture. Otherwise, we're definitely doing our kids a disservice, which I see all the time, unfortunately.
Thank you for that.
But that's the difference. Yeah, that's the difference.
Okay.
With the testing. But there's so many different types of testing. Yeah. So those are the two common ones. But yeah, there's a lot of different types of tests that can be given.
Is there an age minimum for any of these tests?
I do age 3 and up. But there are tests. Actually, there's infant psychologists that focus on the little babies. I know. Yeah, really? I don't do under 3. Yeah. They have tests. When I was on internship at Miami, well, now they changed the name. It was Miami Children's Hospital, but they changed it to some other name. But nonetheless, I met them. They were psychologists that specialize in infant psychology, and they would give them different type of tests. It was more looking at developmentally how they were doing. Are they on track for different things? But again, out of area for me, I do age 3 and up. But yeah, there's tests all the way up.
Wow.
So yeah.
Thank you for that. I know that.
Yeah, no problem.
Yeah, I really appreciate the description of the comprehensive assessment because now I have a better understanding of why it might take 6 to 12 months to get off the wait list because it's, like you said, hours and hours with each patient.
Yeah.
So that makes a lot more sense. Thank you so, so much for all of this
Awesome.
knowledge dropping. Like, I
No
feel
problem.
like a weight has been lifted off me, just like being able to talk through some of this stuff. Like I said, I'm a kind of a parent that's in it right now. And Jamie's had her own, challenges with a kid that I think just seems totally developmentally normal. So like, no matter where you are,
Yep.
you're going to be, having these challenges. So I think this is a really useful and meaningful conversation for all of our listeners. So I so appreciate your time and all your expertise. Can you share a little bit about where people can find you and your resources and your books and any of that?
So my last book was ADHD Explained, What Every Parent Needs to Know, which is on Amazon. And I have a new book coming out, but that'll be out next year. But it's more or less to help you make yourself your number one priority. That's something I teach and preach and live now. I didn't always, but I do. I do now. It's been a self-care journey for sure. And I'm usually on Instagram, Dr.Hammond, or any other social media outlet as well. But I try to just be sharing mental health resources often, or if it's inspirational quotes, I live by inspirational quotes too, and just try to stay uplifted and motivated because it's tough sometimes. Like they're just lives, and it can be tough and it can be challenging, but working on making sure that we stay motivated, we stay uplifted, we try to stay connected with others. Like those are the things, and putting ourselves first, making ourselves our number one priority. Those are the things that can help us get through. But yeah, I would love to connect. And my website is drnekeshiahammond.com.
And we'll drop all that in the show notes too, right, Pete?
Absolutely.
Dr. Hammond, you have been amazing. Not just the knowledge, but your energy and your spirit. And we're just so appreciative of you and your time. You can't see me over here, and I know everybody listening can't see me. I have a pen and paper. There's smoke coming from my pen. I was trying to write down everything that you said. So this has been informative and just it's been awesome having you. So thank you so much for your presence and your time today.
No problem.
And you know what? This will be the first episode in 2024 that our listeners have. Is there like a wish that you have for society in 2024 around mental health that you want to offer to our community?
Well, two things. One, I know I said it before, but I'll repeat it. If we could all work on making ourselves our number one priority and understanding that we deserve to be happy, we deserve to be healthy, emotionally healthy, we deserve to have joy. That's one of my wishes. My other wish is that we work as a society on knowing the power of us helping someone else. Like mental health professionals, like there's not enough of us right now to quote unquote save everyone, but we all as a community have the power to help someone else by little things like just checking in with someone. So those I would say are my two wishes for mental health.
Amen. I love it.
Exactly. That sounds lovely for 2024 and beyond. Thank you again. We so appreciate you being here, and we will keep following you. And I can't wait for your book to come out. Congratulations. That's such a huge accomplishment.
Thank you.
I will get a copy of that. You said it's about self-care and all of that stuff.
Yes.
And yes, putting yourself first. So absolutely. So thank you so much.
Thank you.
Thank you so much for listening. I hope you enjoyed our conversation with Dr. Hammond as much as we did, and you took as much away from it as we did. Mm-hmm. I said at the end of the conversation, I just feel lighter just having the tools in the toolbox that I feel like I gained from this conversation. So thank you so much for being here. I know we try to keep our episodes funny, and sometimes when we get serious, it's a little harder to hang on the line for an hour. But I think especially this conversation around mental health, around supporting our kids, around, our parenting styles and intersectionality as we have our kids in all these different environments. So thank you so much for being here. Share this episode.
Yes. And be sure to provide us with your feedback. We like the good, the bad, the ugly, the everything, because that's how we determine which content to bring to you, and just to make sure that you continue to tune in and to learn, but just to be part of our community. So we're looking forward to hearing from you. Dr. Hammond, you are awesome. And you're awesome, Peeve. I don't think I told you that
Shay.
today.
You're awesome. And I love your Christmas sweater.
Oh, you better stop it. Thank you.
Happy 2024 to everyone. And you know where you can find us on Instagram at _is-a-mother-podcast. Please engage with us there. We have been sharing, of course, about our episodes, but also different photos of our personal life so that you guys can get to know us better. And we love to engage with our community there. So thank you for meeting us there.
That's right. And as PV always says, go call your best friend.
Please.
We'll talk to you guys soon.
Love ya.
Bye. Love you too.
Thank you so much for listening and being part of our conversation and our inner circle.
Follow us on Instagram, _is-a-mother-podcast. And we look forward to you and your best friends joining us next episode.
Leave a rating on this podcast app. It really helps us get our conversations to more friends out there, more friendship circles, and more women and more mothers. And that's what we're here for, to broaden the conversation, to bring everybody into the circle.
Thank you for listening. Thank you for joining us. We'll talk to you soon.
Go call your best friend.